CBS News chief medical correspondent Dr. Jon LaPook is here with more on Clinton's health scare. Doctor, in a case like this, from what we know so far, how long does recovery typically take?
Well, typical disclaimer, I'm not her doctor, I haven't examined her, I don't even know a lot of the information that you would need to know. But in general, the kind of information you want to know is what's her general health, what's her age, how much of the lung is actually involved. Now, we don't know that. I don't even know if she had a chest x-ray, was it a CAT scan, was it all on a physical exam where you hear these kind of crackles. It sounds like Rice Krispies when you're listening through a stethoscope. How is the diagnosis made? And then also, what's the organism? Now, she's been treated with antibiotics, and that only treats bacteria, but there are other organisms that can cause pneumonia, and I'd love to know what's being done to help determine the exact cause.
Now, the video that surfaced on Sunday of her leaving the 9/11 ceremony, she was pretty unstable, and a close-up actually showed her feet dragging as she was being pushed into her motorcade. Is that kind of unsteadiness typical in pneumonia cases?
Well, you can certainly see it because of dehydration and weakness that are caused by the pneumonia. Now, she had the pneumonia first, presumably was diagnosed on Friday. She had been sick for a little bit before then. On top of that, then, she's standing out in the hot weather for more than an hour. She's wearing long sleeves and pants, and that's a setup for further dehydration. And the dehydration can cause the drop in blood pressure, which can cause the wobbly behavior. So, we don't know all the facts here, but it certainly is consistent with a diagnosis of pneumonia.
So Clinton is 69. If she were elected, she'd be the second oldest president to take office. Donald Trump, by the way, would be the oldest of all time. Given the relatively advanced age, what else do we know about Hillary Clinton's health?
Well, we know that she's had a number of blood clots in the past, and we know that she had what's called a cavernous vein thrombosis. That's in plain English, it's a clot in her brain. In the past, when she had the flu, and then she fell and she got a concussion. So we don't know every exact detail of her health. I mean, certainly she's been on a rigorous campaign. She's traveled the world. I read somewhere that she had traveled more than 1 million miles as Secretary of State. So she's certainly been able to keep up with a very rigorous campaign. One good sign, I have to say, when she emerged after she went to her daughter Chelsea's apartment to cool down, when she emerged, she was standing up and she was waving and she was able to talk and say, I'm feeling fine. If she were really sick, you would expect she wouldn't be being treated as an outpatient. She'd be being treated in the hospital. So.
She also had that touching moment with the child, hugged the kid, had a picture taken. Maybe we should check on the health of that kid tomorrow or the next day to find out. Dr. Jon LaPook, I appreciate you walking us through this.
Thanks.